Good morning, everybody. You still awake? That was a very nice movement break. Got my brain cells firing. So today I'm going to talk a little bit about the psychological and cognitive aspects of PD. Dr. Rodriguez introduced some of these things, which is great. Repetition is helpful. And so, let me see if I got this clicker correct. Okay. So this is a really nice image that I found through some organization. I can't give credit like I should. But it shows that there are motor symptoms that are the symptoms that everyone sees. But there are so many other symptoms that others may not notice that are happening within you. And just as was mentioned earlier, a lot of these symptoms are not symptoms that everyone experiences. So there's a whole lot of individual variability. Some people experience depression or apathy or anxiety or cognitive deficit. Other people may not or may not experience that to the same degree. I'll talk today a little bit about some of these non-motor symptoms. And because this is a 30-minute presentation, I'm going to try to highlight some important aspects of these things without going into a whole lot of depth. But just know that at the end of this presentation, I'll provide my email address on the screen. And if you have any questions or would like more depth of information about any of the things that I talk about, please feel free to contact me. So depression is probably the most researched and most common symptom reported in Parkinson's in terms of psychological symptoms. And what's interesting about depression, and actually several of these psychological symptoms, anxiety as well and apathy as well, which we'll get into, is that a lot of individuals will tell me, I actually experienced depression or anxiety for the first time several years before I was diagnosed with Parkinson's. And that's because there are neuroanatomical, neurobiological changes happening in the brain long before those motor symptoms even emerge. So some of you may have noticed that you had feelings of feeling sad or down or lower interest or panic that you maybe had not even had before. And that can happen several years prior to the onset of motor symptoms. About 50 to 70% of individuals with Parkinson's do experience some aspect of depression. 35% endorse clinically significant symptoms, which really means that the depression is such that it's impacting their daily functioning or causing significant distress. It's really more to describe that the level of depression is perhaps more severe or significant. And one interesting question is depression present because of just simply having this reaction to a diagnosis, which is possible and present frequently, definitely. But also, just as I mentioned, it's a biological aspect of the disease process because of those neurochemical changes that happen early on. And in comparing individuals who have Parkinson's with others who have conditions with similar disability, those with Parkinson's have about a 3 times higher likelihood of having depression even years before the disease is diagnosed based on the motor features. So as a psychologist, a neuropsychologist, when we are assessing for depression, trying to identify it or recognize it in a person, these are the symptoms that we're really looking for. Does this individual express feeling sad or down or hopeless? Is there a reduced interest in activities, more so than before? And then there are several somatic or physical symptoms, and then there are some symptoms that are related more to cognitive aspects. Now, in Parkinson's, even in someone who does not have depression, a lot of these symptoms are present. That makes depression hard to identify. In Parkinson's, you might have appetite change or sleep disturbance or a psychomotor slowing, and it does not necessarily mean that depression is present. And so a lot of times we'll see family members or spouses or caretakers or others in your loved one's life who are noticing these symptoms, thinking that it's depression when actually it may not be. So it may or may not be. It can also be difficult to identify because It's not often reported. And that's something also that was highlighted in the last presentation. It's really important to bring this up with your doctor because there are things that can be done. And the goal really is to improve quality of life, right? So if you can address any of these things either from a medication standpoint, or there are several options from a non-medication standpoint as well that we'll talk about at the end today. The other thing is sometimes in the clinic it's not assessed for thoroughly. So some clinicians may not inquire, and so it really puts it on you to bring these things up if you are experiencing this. And then thirdly, because a lot of individuals with Parkinson's have this masked facial expression, that can be misinterpreted as depression when it's not there, or make it hard to identify if it is there. The other thing I want to point out is that apathy is another common symptom that individuals with Parkinson's experience, and we like to consider these as separate from depression. Apathy certainly is a symptom of depression, has to do with reduced initiative, maybe there's a reduced interest, but also it can exist as its own syndrome as well. When we're talking about apathy, really what we're describing is a reduced self-generation. So there are several neurochemicals involved. It's not only dopamine that's involved in this, but because of that reduction in dopamine and that depletion in the basal ganglia that occurs in Parkinson's, that frontal lobe of the brain is not getting the dopamine or the gasoline that it needs. And so that self-initiative might be lacking. You might notice this occurring in one of three different ways. Perhaps you're not being as productive as before, not engaging in activities like you did before, or perhaps you're not planning ideas or discussing thoughts and ideas like you were before. Or this may show up more in an emotional sense. You may become a little more flattened, not experiencing high excitement or happiness, and also not experiencing a lot of feeling down, just more neutral. So that's what really apathy is referring to, is this reduced self-generation or initiative in any of these domains. And it's very common also, as similarly to depression, we see about 20 to 30% of individuals experiencing that symptom early on. Now, the dopaminergic medications often do help with that, but apathy often increases a bit as you go forward. Now, I like to bring this up because, I'll mention here, it's often misinterpreted too. So some family members will say, he just doesn't want to do anything. And I have to really explain, it's a result of this biochemical change, right? And there are some things that you can do about this. I think it's very important to pay attention to, because unfortunately, both apathy and depression, if not addressed and not really looked at and dealt with properly, can have some negative consequences. Both are associated with some things you don't want. So faster cognitive decline, poorer overall quality of life, faster physical decline, and also some increased stress with caregivers and with families. So I always encourage individuals to really try to work on this stuff because you want to improve your physical function. Let's just give an example. If you are apathetic and not initiating activity, you may not be initiating in physical exercise that could help improve your mobility. If you are apathetic and you're not feeling that initiative, you may not be as compliant with medications or other treatment plans. So these are just some examples of what I mean when I say it's important to talk about and to really try to get a handle on. Anxiety is another one. Some of you may experience this, some of you may not, but just to know about this I think is helpful. About a third of individuals experience anxiety in this process, and most commonly there are several different types of anxious or anxiety conditions that are experienced. As you can see over to the right of the screen, it says NOS anxiety. And what that refers to is a not otherwise specified anxiety. Specifically in this research study, they had looked at PD-specific anxiety. So having nervousness or anxiety about being around others in a social setting because of Parkinson's symptoms, like drooling or dysarthric slurred speech, these are some examples, or fear of falling. It's also pretty common for individuals to experience GAD, which is generalized anxiety disorder. Generalized anxiety refers to this general anxiety or anticipatory anxiety that is hard to control. And then also we see agoraphobia, sort of a avoidance of settings that someone might feel trapped or may fear that they are going to have a panic attack, and then panic also may occur. Once again, this is something that often people will say, I had a panic attack before I even was diagnosed, now it makes sense. And then psychosis, this was mentioned earlier too. Some people say I am experiencing this because of a side effect of medication, and that's not uncommon. Some individuals will experience it actually separate from the medication too, and as the disease progresses, more people endorse this as a symptom. Now, illusions are more common, particularly early on, and that really refers to seeing something that is in front of you and misinterpreting it as something else. For instance, you may see a stick on the ground and see it as a snake. And then when you get closer, oh, that is not a snake, that is a stick. And then hallucinations early on often present more as these minor hallucinations, like passage or presence hallucinations. Passage hallucination refers to seeing something moving in the periphery, but when you turn to it, there's really nothing there. So your eyes are playing tricks on you. And then the presence hallucinations refer to the experience of feeling that somebody is near you and actually no one is. Now, over time, this may develop into more vivid visual hallucinations. More often we see in Parkinson's, it's a visual hallucination, and less often we'll see auditory hallucinations or feeling that someone's touching you when there's nothing touching you. But these sensory tricks or disturbances are not too uncommon. Now, initially, individuals with Parkinson's tend to have really good insight about this, and I've seen many people who have experienced pretty significant vivid hallucinations and are not distressed by it because they recognize this is part of the disease. I'm seeing, a person here, or I'm seeing an animal or what looks like a bug going across the table, and I realize that this is my mind playing tricks on me because of Parkinson's. As the disease progresses, you may find that there's less insight, and then that can develop into delusions, like believing that the people that I was seeing outside of my window are actually there, and now developing this paranoia. Again, there's treatments for this, and so it's important to mention this to your doctor as well. Finally, cognitive changes. As a neuropsychologist, most of what I do in my day-to-day clinic practice is assessing cognitive change. So people are usually coming to me or referred to me to evaluate some concern of memory decline or other thinking changes. Now, a lot of people may think, I am experiencing memory decline. And it's my job to really determine what is that pattern of memory change, and is it really due to an inability to learn and store information, retain information, or is it due to something else, like not being able to focus as well during learning? If you're not able to focus as well during learning, of course you're not going to get that information in very well, and your memory will not be as strong for it, right? In Parkinson's, most of the time with memory deficits that are reported, it's not that the person cannot learn and store information. Typically, that is rather preserved. Instead, it has more to do with the ability to focus during learning, take time during learning, because there tends to be what we call bradiphrenia, which is just the slowness of processing information. Just like you might notice a slowness in your movement, there also often comes along with that a slowness in processing. And so you just have to learn to take more time and allow yourself more of that grace and that time during learning. And the memory difficulties that we see are often usually more of a memory retrieval problem. I cannot access the information that I learned earlier, but it is in there. I like to think of that as the files in the cabinet are still there, the material in there is still there, but the file labels are missing. And so accessing that information has gotten harder. I can't retrieve it, but if someone reminds me of that information, oh, there it is. That's what we had talked about earlier. So that's the pattern in Parkinson's that we would typically see in terms of cognitive change. Spatial deficits are also common, perhaps finding your way somewhere or not being able to park into the lines of the parking space quite as well. Those are things that are often not really noticeable in day-to-day life but show up on testing. And language is generally spared. I don't see a lot of changes in language functioning unless it has to do with speeded word retrieval. I can't think of the word I'm looking for, but I certainly still remember what the word means. Now, this is a slide that just shows cognitive change and sort of a trajectory, if you want to call it that. Early on, you may have some subjective memory decline. In fact, early in the disease process, a lot of people report, I think I feel some memory change, and it may or may not even be detectable on testing because it's something so subtle that just the patient themselves might notice it. Now, over time, that may become a little bit more so, and we might diagnose that as mild cognitive impairment. Now, mild cognitive impairment, without getting into it in too much depth, really means that there is some legitimate cognitive deficit compared to others your same age, but it's not impacting your functioning in any significant way. You're still able to manage your bills and manage your appointment schedule and so forth. But you're just noticing that there is this decline, and it is really there even on testing, but not so impactful in day-to-day life. And then finally, dementia. Just like Dr. Rodriguez had mentioned, dementia is not present in everyone, but some individuals experience this, and it is definitely associated with disease duration, as well as you may even see hallucinations associated with a dementia too, and just like was mentioned, it's more common in individuals who have more of the akinetic rigid type, but again, some people, they just don't have cognitive deficit to that degree. Now, after about 20 years of disease duration, about 83% of individuals will be diagnosable with dementia, and what that means is that that cognitive deficit is now impacting their daily functioning to a more significant degree. You need help with the medications, you need help with managing finances or keeping up your appointment schedule because it would be too difficult to do so on your own otherwise. And Parkinson's disease dementia is different from other types of dementia in that the issue is not such a memory prominent dementia like you might see in an Alzheimer's disease. It's typically more that there is a deficit in executive functioning, planning ahead, being able to organize, being able to get the medications ordered in time so that when you run out, you have them. That kind of thing, mental flexibility, processing speed, certainly some aspects of memory too. So, what do we do about it? We know we have some of these symptoms. What can I do? And so I want to focus now really on that aspect. What are some action items that you can take moving forward? Physical activity, that is really probably number one. And I'm sure everyone knows this. This is not something that you don't already know, but I think it's worth really talking about. There are all these signs, right? Boxing, cycling, there's these different things that you can get involved in, and it's so important, not only for physical health, but for brain health itself. There are so many studies that exist looking at this, and physical aerobic fitness, where you're getting your heart rate up, has been shown to improve learning, executive functioning, memory, even in individuals with Parkinson's disease or without. So really that's something that's very important. And the exercise also has an impact on the brain itself. You can increase brain-derived neurotrophic factor, which is a growth factor for the brain cells to protect them. So that's something that I won't talk more about, but certainly is very important. And there are lots of opportunities, particularly within the Parkinson's world. So many different great organizations and programs to increase this or help you to stay physically active. Social and mental engagement. Take a dance class. Come to a talk. Hey, you got that one. So this is great. You're already here. You're learning. You're trying to stimulate your mind. That's really important. You want to stimulate those brain cells, not from only the chemical perspective that you get from physical exercise, but also from learning something new and challenging and novel. Eat right and sleep right. Again, I really would love to go into this even deeper because it's so important, your health, your physical health, and really your vascular health, your cardiovascular health. Individuals that have cardiovascular issues are at increased likelihood to develop dementia really of any kind. Parkinson's, Alzheimer's disease, different types of dementia. So getting your vascular health in check, and if you are having any cardiovascular issues, high blood pressure or diabetes, just making sure that those things are very well managed is good. And eating and exercising can help with all of that as well. And prioritize your psychological health, which is what I want to go into right now. So as has been mentioned, talk to your doctor. Don't be shy about it. Be open with your psychological experiences, any kind of memory issues you may be experiencing, or other cognitive changes. There may be medications that can help you, and oftentimes that is available. Now, some people don't really want to add medication, and that's fine. There are non-medication options too, and available through psychotherapists or mental health counselors or licensed clinical social workers that can really be beneficial to getting you on the track, getting you on the right track with mental health. Now, I did put up here on the slide, are my psychological symptoms associated with wearing off? Because I think it's important to mention that some individuals experience anxiety or depression as almost like a precursor to the motor symptoms where your medication is wearing off. And so that suggests that it is related to some of that neurochemistry and could be addressed with the medications. Other times people are experiencing that separate from that, but it's just something to point out. It can be associated with those motor fluctuations as well and maybe precede the motor fluctuations or the motor onset of symptoms. There's been a whole lot of talk and research about cognitive behavioral therapy. If any of you have pursued psychotherapy for this is something that many of you may already be familiar with. This is a therapy that was developed for depression, but has been very helpful for depression and anxiety and several other things, and has been shown effective in Parkinson's specifically too. Now, in cognitive behavioral therapy, really there are several different aspects of the therapy. The primary focus, I would say, is on addressing cognitions and restructuring thoughts that would be considered maladaptive, perpetuating your depression or your anxiety. A lot of times people will, through this practice and recognition and training, will learn, hey, wait a minute, I have these what we call cognitive distortions or cognitive biases. I have a habit of thinking, of making assumptions, for instance. I walk into a room, I see someone laughing, I make an assumption that it's about me, I get anxious, when actually there are some alternative perspectives to consider, some alternative explanations. Maybe that person was laughing because they were thinking of something funny from earlier in the day. And that's just one example. There are all kinds of these different habits of the mind that we develop as habits maybe even early on in childhood, or we may develop them later on. Black and white thinking, forgetting to really address the gray area of things, or labeling or name calling. Oh, I'm so stupid, I forgot to do that. Those are the things that we sort of point out and then try to help you to restructure that negative thought into a positive, or at least into a more neutral comment, so that you're not sort of perpetuating this negative mood. And behavioral activation is so important. This is helpful for depression and for apathy as well, getting your get up and go back. And in my research, when I was in training, a lot of what I did was research with apathy and looking at really how we can set goals to help increase your activity engagement. And when we talk about activity engagement, we're talking about incorporating some positive, enjoyable events or activities in your life that you enjoy and would make you feel happy. Incorporating that into your week is so important. And one way of going about this is to first start by setting some goals. If you can just think about even one goal that you have for yourself that you think would be helpful for improving your mood or your motivation. When I work with individuals, we come up with a set of goals, maybe 3 to 5 goals, but we always start with one, and then we work from there. This might be a physical activity goal, a goal that involves increasing your socialization because of the benefits of that on mental well-being and on cognitive health as well, on brain health. It may be involving yourself in activities or support groups or boxing class or something of that sort. It may be a goal that you have around the house, something that is unfinished that you want to get to. It may be a goal that's related to increasing connection with other people, with family, with friends. Pick a goal, and then the best way to achieve these goals is really to be smart about how you set the goals. And so when I say smart, I'm talking about setting SMART goals. In motivation research and in businesses, this might be something that you have come across in a workplace. The goal should be very specific. If physical activity is your goal, what kind of activity? When you leave it vague, you're less likely to engage and less likely to accomplish the goal. So let's make it as clear as possible. Is it swimming? Is it yoga class? Is it walking? What is it going to be? Make this goal measurable. How many laps in the swimming pool are you going to do? How many minutes are you going to spend doing this activity? It has to be attainable, because if it's not attainable, if it's too much for you, it's going to be discouraging and you might give up. In general, I like to say the goals need to be not too easy and not too hard. You want to have this motivation to engage in these goals, but you also don't want to be so overwhelmed that you give up early. And then it needs to be relevant. It needs to be something that you have a personal interest in. If someone's telling you to do it, your motivation to do it is just simply not as strong. So something that has some meaning for you and that you see a benefit of. And then it needs to be time-bound. What days of the week are you going to engage in this activity? What time of the week? Monday, Wednesday, Friday, and Saturday at 10 a.m. I'm going swimming, and I'm going to do this for 15 minutes. That's a very smart goal. What am I going to do if some interference comes up? I'm going to reschedule that. What am I going to do if I don't feel like doing it that way? I'll remind myself the importance of brain health and activity on my physical well-being and on my mental well-being. So these are things to plan for so that you can increase the likelihood that you can achieve these goals. And then finally, anxiety is something that can really be benefited by a lot of these things on this slide, but also depression as well. And when I get to mindfulness, we'll talk about how also there's benefits beyond psychological benefits. With relaxation, there are several different strategies that can be helpful. And again, these are things that you can learn from a psychologist. These are not sessions that have to go on forever. There can be time-limited psychotherapy that can help you to gain these tools and use them at home. With relaxation techniques such as deep breathing, you may learn how to breathe in for 4, breathe out for 6, right? That's a way to kind of relax the heart rate. If you practice this, you'll notice when you breathe out, your heart rate slows down a little bit. Progressive muscle relaxation is a way to relax every part of your muscle, your body. So relaxing your toes, relaxing your legs, relaxing your arms, and going your way up. When I was a kid, my grandmother used to do that when we were falling asleep, and we were asleep before it got to the top. So that's something else to consider. And guided imagery. Imagine that you're at the most relaxing, positive, calm place for you. You're at the beach, maybe you're in a field of flowers, maybe you are in your room because that's your favorite safe space. Make that very vivid and detailed. What does this area smell like? What does it look like? What does it feel like? What do you hear? That image is a place you can always go back to calm yourself down in any moment. And then finally, mindfulness. This is something I could talk about for a whole hour, so I will just limit it to saying, please go look this up, because mindfulness practice is helpful for depression, it's helpful for stress. Are you feeling overburdened? Mindfulness can help. Are you feeling anxious? Mindfulness can help. Are you having trouble with attention, executive function? Guess what? Mindfulness can help, because each practice that you learn during that training helps you to learn to focus on the present moment. And why not focus on the present moment? We really want to increase quality of life, right? We want to enjoy every single day and every single moment. And mindfulness practice is really all about that. It's about being present in this moment, learning how to have self-compassion, compassion for others, and that's something everyone could benefit from. So thank you all.